Respiratory disorder, pharmacy practice questions for PEBC evaluating exam. SABA. What is SABA? SABA is short-acting beta-2 agonist. It is used for rescue. So drugs under short-acting beta-2 agonists are salbutamol, terbutalin. Salbutamol, terbutalin. It is used in asthma attack, then exercise-induced asthma, COPD symptom relief, and ER exacerbation. So, salbutamol and terbutalin are the SABA. They come under the SABA category. What is SABA? SABA is a short-acting beta-2 agonist which is used in an emergency situation. It is used in acute asthma attack, exercise-induced asthma, COPD symptom relief, and ER exacerbation. After that, the second category is LABA. What is LABA? Long-acting beta-2 agonists. It is used for maintenance. SABA was used for rescue. LABA is used for maintenance. The drugs under LABA are formoterol, salmeterol, vilanterol, indacaterol, olanterol. It is used in asthma only with ICS, that is inhaled corticosteroids. So LABA is used in asthma, but it is used in combination with ICS, that is inhaled corticosteroids. COPD maintenance. It can be used alone or in combo. So remember guys, never use LABA alone in asthma. If patient is having asthma and doctor has prescribed only LABA, then it is a very questionable thing. Okay. So always remember LABA should be given with ICS. COPD, it is used in COPD for maintenance alone or in combination. So LABA plus ICS is for asthma and for COPD maintenance alone or in combination. After that, SAMA. What is SAMA? SAMA is short-acting muscarinic antagonist. The drug under SAMA is ipratropium. What is the drug? Ipratropium. It is used in COPD, ER asthma as an add-on, and acute COPD exacerbation. SAMA is what? Short-acting muscarinic antagonist. Drug under SAMA is ipratropium. It is used in COPD and as an add-on in ER asthma. It is also used in acute COPD exacerbation. Fourth category is LAMA. What is LAMA? LAMA is long-acting muscarinic antagonist. Drugs under LAMA are tiotropium, glycopyrrolate, umeclidinium, aclidinium. It is used in COPD as a first-line maintenance and as an asthma add-on in severe cases. Tiotropium, glycopyrrolate, umeclidinium, and aclidinium. After that, ICS. ICS is what? Inhaled corticosteroids. What is ICS? Inhaled corticosteroids. Drugs under ICS are budesonide, fluticasone propionate, fluticasone furoate, mometasone, beclomethasone. These drugs are inhaled corticosteroids. They are used as a main controller in asthma and COPD only if frequent exacerbation is there. Okay. So ICS and LABA are used together for asthma. Okay. So sixth category is ICS plus LABA combinations, which is very important for the exam point of view. Example is budesonide plus formoterol. It is a Symbicort. That is a brand name. Fluticasone plus salmeterol, Adavir. And fluticasone plus vilanterol, Briolepta. Mometasone plus formoterol, Zenhale. These drugs are the combinations. They are used in moderate to severe asthma attacks and in case of severe COPD. Following that, seventh category is a combination drug, that is LAMA plus LABA. LAMA plus LABA is used for COPD. When it is moderate to severe COPD, LAMA plus LABA is used. What are those drugs? Tiotropium plus olandaterol, umeclidinium plus vilanterol, glycopyrrolate plus indacaterol. So, in this case, what is LABA and what is LAMA? Previously studied tiotropium, umeclidinium, and glycopyrrolate. These are all LAMA, and olandaterol, vilandaterol, and indacaterol are all LABAs. After that, scenario 1 we will see acute asthma attack. Okay, patient is having acute asthma attack. 22-year-old female, sudden wheezing and chest tightness, needs relief within the minutes. What will you do? So patient is having an acute asthma attack and she is having sudden wheezing and chest tightness. So the first drug that we saw was SABA. SABA is used for rescue. So we will give salbutamol. Why we will give salbutamol under the category SABA? Because it is having fast onset within 5 minutes. It's rescue medication. It opens the airway quickly. It is used as a PRN, and LABA is too slow. Too slow means except formoterol, but it's still not forced in the emergency. We are not using LABA because its action is too slow. Except formoterol. Formoterol we can use, but still it is not a first line in emergency. We will use only SABA, that is salbutamol, when a patient is having acute asthma attack. Next, second scenario is mild persistent asthma. Patient is 25-year-old. Patient is having asthma symptoms 4 days per week. Means there are 7 days, and from 7 days, every 4 days she is having asthma symptoms. Using salbutamol frequently. Salbutamol is given in an acute condition. Okay, patient is having acute asthma attack, then we give as a first line treatment, that is SABA, salbutamol. But if patient is using it very much frequently, then there is a concern. Then we need to add a drug, add-on drug, that is ICS, inhaled corticosteroid, on a low dose. So the second step will be low dose inhaled corticosteroids needs to be added if patient is using salbutamol frequently and patient is not uh, getting what relief from the symptoms. So why we are adding low dose ICS? Asthma is an inflammatory disease. Frequent symptoms needs a controller, and SABA alone is not enough. Okay, patient is having frequent symptoms. So this frequent symptoms needs to be controlled, and that SABA cannot do it alone. That's why we are adding low dose of inhaled corticosteroids. Scenario 3 is not controlled on ICS. Patient is 30-year-old on low dose budesonide. Budesonide is a LABA and patient is still symptomatic. What needs to be added? So budesonide plus formoterol. Formoterol is an inhaled corticosteroid. So LABA plus ICS is a combination we are going to give. Why? Step up therapy. Never give LABA alone in asthma. Okay? We're never going to give LABA alone in asthma. Along with that, we are going to give patient inhaled corticosteroid. Always remember this point, which 100% you are going to get a question on this. Scenario 4, COPD, new diagnosis. 68-year-old smoker, chronic breathlessness, diagnosed COPD, first maintenance drug. So first line maintenance drug for COPD is LAMA, that is tiotropium. Why? Because COPD is a condition where air trapping is happening. LAMA relaxes the airway via anticholinergic action. Drug of choice for maintenance. Always remember, LAMA is a drug of choice for maintenance and patient is diagnosed with COPD. Scenario 5, COPD is still symptomatic. 70-year-old patient on tiotropium. Tiotropium is what? LAMA. and still breathlessness, what you're going to do next? Add LABA. LAMA plus LABA combination for COPD we are using, that is dual bronchodilation improves the airflow. COPD with frequent exacerbations. Patient is COPD and two hospitalizations last year. What to add? Triple therapy we are going to give you. Okay, patient was first on LAMA, then we added LABA. Now we have to add one more, that is ICS, inhaled corticosteroids. So these three combinations together is known as triple therapy. Frequent exacerbations, add steroid. Patient is having frequent exacerbations, we are going to add steroids. Scenario 8, ER COPD exacerbation. Emergency room COPD exacerbation. COPD patient is in the ER, severe dyspnea, immediate bronchodilator. We have to give an immediate bronchodilator. So SABA plus SAMA. SABA is a salbutamol and SAMA is ipratropium. Okay, these two combinations we are going to give. Short-acting muscarinic antagonist ipratropium and short-acting beta-2 agonist salbutamol. Why we are giving this combination together when patient is having COPD? Because dual short-acting bronchodilators act quickly. Ninth scenario, patient cannot coordinate MDI. Elderly with arthritis, best devices dry powder inhaler. No need to press, plus inhale coordination. If you are going to give a patient who is elderly and you are going to give him meter-dose inhaler. Okay, so what will happen? Patient, there will be a compliance issue. Secondly, so we will give him the best device where patient can use it is dry powder inhaler, where patient is no need to stress and he can inhale with coordination. Scenario 10 is exercise-induced asthma. Patient does the exercise and asthma gets induced. Young patient wheezing only during exercise. What to use before the exercise? So 15 minutes before the exercise, we are going to use SABA, that's short-acting beta-2 agonist. After these 10 scenarios, we are going to see these questions. What cannot be measured by spirometer? So residual volume we cannot measure by spirometer. Normal FE1 by PEBC ratio, it's approximately 80% in adults. Gold standard for diagnosis of asthma and COPD is spirometry. So using spirometry, we can diagnose asthma and COPD. This is a gold standard. And with spirometer, we cannot measure residual volume, but spirometry we are using for diagnosis of asthma and COPD. What drugs relieve symptoms of asthma, chronic bronchitis, and emphysema? So, short-acting beta-2 agonists. Examples, salbutamol are used to relieve the symptoms of asthma, chronic bronchitis, and emphysema. Rinsing mouth prevents the side effects of. When we are using inhaled corticosteroids, there are chances the patient may suffer oral thrush. Therefore, it is recommended that the patient should rinse his mouth after taking inhaled corticosteroids. So, rinsing mouth prevents the side effects of inhaled corticosteroids. Used for prophylaxis, not acute attack. Okay, patient is having asthma, and we do not want it to be induced. So cromolyn sodium, montelukast, LABA with ICS are recommended for prophylaxis. They are not used when patient is having acute attack, but they are used to prevent the attack. So cromolyn sodium, montelukast, and LABA with ICS. And LABA we are never giving alone in asthma patient. We are always using in combination with ICS. Asthma triggers. So exercise, emotional stress, cold air, allergens, viral infections, all this triggers the asthma. Not a trigger. Corticosteroids does not trigger asthma. Drug of choice in COPD is LAMA. LAMA is what? Long-acting muscarinic antagonist. Example, tiotropium. COPD exacerbation bacteria. Okay, what is that bacteria name? Streptococcus pneumoniae. What to add if the patient is on salbutamol and tiotropium and still uncontrolled? Salbutamol is SABA, tiotropium is Lama. And they are saying patient is still uncontrolled. Then we are going to add LABA. Avoid in COPD two LABAs, two LAMAs, LABA alone. And this is a controversial thing, LABA alone. Volume exhaled in 1 second. FEV1, total air forcibly exhaled. Normal quiet breathing is tidal volume and cannot be measured by spirometer is residual volume. Then next thing, NSAIDs precipitate acute asthma attack. Always remember, NSAIDs are going to precipitate acute asthma attack. If the patient is using ibuprofen can induce the asthma attack. For NSAIDs or aspirin-induced asthma, patient should be recommended to use acetaminophen and desensitization with montelukast is used. The rhinitis is not a symptom of asthma. Symptoms of asthma are cold, wheezing, sputum production. If you like this session, I would request you to please subscribe and like the channel. Thank you.